Alrighty, folks, welcome to another edition of the Healthy Way right here on Love 101, the Fabulous Station. Now, since the first Monday in September, we're looking at childhood cancer. September is Childhood Cancer Awareness Month, and today is the final in the series. And with us this morning is Nurse KAYDIA Landell-Collins, Pediatric Hematology Oncology at the Bustamante Hospital for Children. How are you, nurse? Welcome.
Hi, good morning, Giovanni. I'm good, thank you.
Great. Tell us a little about your profession, no nurse.
Okay, so this profession is a highly specialized and sensitive role.
Mhm.
We deliver care to children with cancer and blood disorders. This specialty is very challenging but also very rewarding. We
Right.
help children by making a difference in their lives.
And when you say role, what is it that we're talking about? What is the role of the nurse in caring for children with cancer?
Okay, so as an oncology nurse, we administer treatment and monitor our patients' progress while also providing education and support for children and their families. Childhood
Mhm.
cancer not only affects the child but also the entire family. So we practice family-centered care. We are patient advocates.
Mhm.
We also administer palliative treatment and we collaborate with other members of the healthcare team to give our kids the best quality of life.
Mm. You say practice. So, how long have you been working with children with cancer?
Well, I have been working with children with cancer for most of my time here at Bustamante, which is approximately 10 years. However,
Mm.
I started working more closely with them since I completed my training in 2018.
Right. And what has the experience been like?
It has been, it has its ups and downs. It has been rewarding, as I said before, but
Mhm.
also very challenging.
Mhm. Yeah, I can imagine, especially in light of what's going on now.
Yes.
Right. Now, in terms of pediatric oncology nurses, but how many
hmm
are we talking about that are trained here in Jamaica?
Currently, there are about 10 of us here in Jamaica. It's kind of a new specialty here in Jamaica and even in the Caribbean.
Hmm.
And there is definitely a need for more trained pediatric oncology nurses. We have the general oncology, but
Hmm.
pediatric oncology nurses, we're just few in numbers in Jamaica.
Right. What's the difference between the two? Pediatric is children, I would
So,
imagine, right?
right. And adult is the general. The general deal with everybody.
Mm. And so, 10 of you, so it makes the job a little more difficult, would you say?
Yes, yes, it is. We have to train other nurses on the unit too, so that we pass on our knowledge to other nurses.
Just in case you can't come in one day.
Well, definitely, and
Right. That's good. And in terms of challenges, what would you say is the hardest part of your job?
oh, well, I would definitely say it's the end of life care
Yeah.
when we lose one of our kids when they lose one their battle with cancer.
Mhm.
It's very, very challenging. And, after accidents and trauma, childhood cancer is the leading cause of death in children between
Mhm.
the ages of 1 to 14.
Right.
Therefore, as an oncology nurse, we have to deal with death, very more often than we like.
Mhm.
It is a very heartbreaking and emotional field. We have times that we have to take a break and cry, or when we go home, we cry.
Mhm.
But we have to put on a smile and show up for work the next day because there are other patients dependent on us.
Right.
Oftentimes I am asked, how can you possibly take care of children with cancer?
Right.
But the real question for me is, how can you not? Trust
Mhm.
me, you have not seen bravery and resilience until you have met a child fighting cancer. Their strength give us strength to keep on fighting with them.
Right. Now, you say you break down every now and again. You cry at home or you cry at work. Um, how are you managing though?
We just have to find ways to cope. Sometimes we have debriefing sessions where we talk about it,
Mhm.
and just it's very, very challenging. But we the strength of the patients. I know there are other patients depending on us, so we just
Right.
have to put on a smile and just show up and yeah, continue to do what we're doing.
Um, and when you leave home, when you leave your family, um, you just never know what you're gonna run into when you get to
Mm,
work,
Definitely not.
right? Um,
Could be a good day, could be a bad day.
right. Now, I want to ask a little about the good day, because I'm pretty sure you've had some very
Yes,
good
we have had
times.
good days. I would have to say when our patients have completed their treatment and their cancer is in remission, you feel it's a good feeling.
Mhm.
These kids are the biggest superheroes I know, and they help to make my job so rewarding.
Right.
Even though we get emotional satisfaction from just knowing that we've helped these children and their families during a frightening and traumatic time.
Right.
Even if sometimes, the outcome is not what they hoped for, but just being there to offer any support or kindness and the best care possible.
Mhm. You say frightening and traumatic. What is it that you would say to the child or to the parent when they
So
have to
for
go
the
through the
child, we allow
right?
the parents to kind of break the news to the child because they know their children, so
Mm-hmm.
they are the ones who actually break the news. But we offer support in that regard if
Mm-hmm.
we're there to offer any support to them during the period where they break the news to the
To the
child.
child, right?
And just the family. Just imagine a parent. I know once
Mm-hmm.
they hear this news, it it can be really frightening.
Right. I can imagine. No, a moment ago you said something about superheroes. I know you had dress up day costume thingy last week. you
Yes,
know,
we did on Friday.
on Friday. Because I know I was talking to Dr. Burton at the start of the month, and that's one of the things he had said to us that you always have a little something to the children to kind of lighten them up. How was
Right,
that?
and
How
we'll
did that?
also have a treat this week.
How was Friday? How did that go?
It was okay, not as we had expected, but it was okay. The doctors they came out and they dressed
Mhm.
up and they came on the ward. Some of the
Yeah.
kids were excited, to see Batwoman and
And Spider Man.
no, we didn't have any Spider-Man.
Right. Okay. And then there's a treat you said coming up this week.
Yes.
Yeah. So that should be really nice. That should be really nice. But before you go, nurse, what's your word of encouragement or advice to a parent or a child going through childhood cancer? What do you want to say to them at this time?
Just to continue, we are here to fight with you guys, and we just want not only parents but other persons, because not a lot of persons. We tell them
Hmm.
childhood September is childhood cancer awareness month. They're like, what? And we said yes.
Right.
We want persons to know that childhood cancer is real, and we hope to get their support in the fight against this disease.
Beautiful. Can I thank you this morning? Appreciate it. Yeah.
Thank you too, Shivani.
And
Thanks for
I
having me.
sure, and I pray you all the very best. Keep fighting. We need you around. We can't do without you, nurse. And so I pray you strengthen the other nurses too. Thank you so much.
Okay, thank you.
Great. Nurse there, nurse. Yeah, nurse Landell-Collins. Really, really nice. Yeah. Yeah. Hematology oncology. Nurse at the Bustamante Hospital for Children. And that's where we sort of put a wrap on our discussion, our conversation this month. Childhood Cancer Awareness Month. So we salute our heroes, those who are fighting. Remember the gold ribbon? Yeah, that's for our children. And so we want to remember all those who are going through, you know, the battle, right? And the family too, the mother, the father, the auntie and the uncle, the grandma, the grandpa, and the brother and sister. It's not an easy road. And so we stand with all those who are fighting, all those who are battling. Yeah, we just want to remember our nurses, our doctors in a very special way today as they continue to just be there for our children. Really nice. Thanks again, nurse. Right? Thanks to Dr. Burton, Andrew Burton. And thanks to Martina, too. Dr. Martina Daya. They've been with me. And so I say thank you to both of you. This is Love, and it is the Family Station.